Hello, my name is Jean, and I want to show you an animated picture of what a healthy colon is supposed to look like, courtesy of ADAM. This shows you the large colon right here, the small intestines right here, and this is the rectum. The purpose of my speech today is to inform you about colon cancer and to give you the signs and symptoms and preventions for colon cancer. The overview of my speech is basically just telling you what colon cancer is, giving you definitions of it, and walking you through step by step what the different signs and symptoms are and what you can do to prevent it from happening to you. Colon cancer is known as colorectal cancer, rectum cancer, or also bowel cancer. They have different names for it, just depending on the different location or where it is. Cancer of the colon is an uncontrolled cell growth in the colon or rectum, which is called the large intestines or the appendix. And that is courtesy of Wikipedia. This right here is a picture of an adenocarcinoma. This was taken when the patient had a colonoscopy. As you can see, the carcinoma looks really big on here, but of course it's not that big inside your colon. But it all ranges. They can grow in different locations, and it depends on the location of the tumor before they can tell you what type of colon cancer it is. Also, the different symptoms are that you can have, and the signs that you may have colon cancer is rectal bleeding, anemia, weight loss, diarrhea, constipation, and nausea. Nausea and vomiting mostly is in people who are, the time you really want to be really nervous and concerned, or if it's a high risk feature, is if you're over the age of 50. If you're getting nauseated, throwing up, having diarrhea, constipated, and you're losing weight, that's when you need to call your doctor to see what's going on. Preventions. There's different kinds of preventions. There are 3 different kinds of preventions. There's called the fecal blood test. That's when they check to see, you go home, use the restroom inside a cup, and they test it to see if there's any blood in it. Then there's also the colonoscopy. The colonoscopy is every 10 years if you have no polyps, and polyps are non-malignant and malignant tissue that grows in the large intestines. If you have no polyps, you go every 10 years. But if you do have polyps, you have to come every year until you don't have any more polyps, or until every time they check that you have a clear. There's a sigmoidoscopy, that's another type of screening, that's every 5 years. Doctors don't recommend this because it doesn't look at the whole colon. It only looks at the left side of the colon. And most of the time, cancer is mostly in the right side of the colon, 42% according to Mayo Clinic. You need to go earlier if you have a family history of colon cancer or colon polyps, even if they're benign. If your family has that history, start going at 45. Also, if you're African American, if you're an American Indian as well. Those are the key factors for you to go in and get screened. Lifestyle change that you can do. This is a picture of an adenocarcinoma. It's growing inside the large intestines. You see how it's eating it all up. Also, like I said, I listed the symptoms. This is just telling you about the rectal bleeding, the bowel change. When it says bowel movement changes, that means you feel like you really have to go, but when you go to the restroom, only a little bit comes out. That's what that means. But you still feel full, like you still full of fecal matter. Also, if you have diarrhea, a lot of people say, oh, I just have diarrhea, maybe I'm sick or something. But it's very uncommon to have diarrhea for 3 or 4 days out, according to Ann Harding in health.com. Wow. So these are the different preventions here. It shows you what a colonoscopy is. This is where you go in and they put a scope in your bottom, looking at your whole colon, starting from the rectum and going all the way up. Then it has the different lifestyle changes and the different habits that you can do, that you can change. The different lifestyle change that you can do are no smoking, no binge drinking, monitoring your weight, and basically just different little things that you can do. I mean, taking aspirin, vitamin D, calcium, those are ways that you can prevent just in your lifestyle, that you don't have to go to the doctor and get prescribed, just little things that you can do on the side, according to Ann Hardway in Health magazine as well. So in conclusion, I have, make sure you get tested. Make sure you get screened. If you have a family history, go get it done. It doesn't, all it takes is you drinking a prep, which at the end of that prep, that's the hard part. The prep is drinking at least a gallon of laxative to clean you completely out. Once you take that, that's the hard part. You don't really have to do anything else but just lay there, go to sleep, and then you can get your procedure done. They take that colonoscope and look up in your colon, and they'll be able to determine if you have any polyps or not. You have any questions for me? Yes, ma'am.
I have a question. Depending on the stage of that cancer for the patient, what kind of treatments would these patients typically be prescribed?
Well, there's different types. They can it depends on the different type of colon and what colon cancer it is in different staging. If it's just in the beginning, the stage 1, you can go in and get a polyp removal, or they'll go in and take it's called a colectomy. It can be transverse colectomy, sigmoid colectomy, wherever that polyp is, they'll cut that part out and anastomose it back together. But if it's aggressive, if it's already in stage 4, because a lot of people don't go in and don't know the different signs or don't know the symptoms, it's too late. So you have to, not too late per se, but they'll put you on chemotherapy and get you those kind of different treatments as well. Any other questions? Okay, thank you for listening to my speech. I hope you guys learned some good information. And like I said, get tested, get screened.
What? It stopped.
Oh my goodness.
I can't hear about colon cancer anymore.
Oh, it didn't.